Thank you, Mr. Leach. And let me just acknowledge all of our witnesses today for your passion on this particular subject and your commitment and dedication to looking for more innovative ways and to use new technology to help improve our foster care system. That has definitely come across in your opening statements here today, and we are grateful for that. We are now going to move to questions from the subcommittee members. And I'm going to start off with my questions. My first question will go to you, Mr. Lasheunda. In your testimony, you highlighted how Illinois and the company that you worked for, Augantel's technology, has helped caseworkers search for information for their case notes. A study conducted by HHS in June found that caseworkers spend an average of 4 out of 8 hours per day on administrative tasks. My question for you is, how does Augantel's technology empower caseworkers to shift from a culture of compliance and administrative tasks to one that allows them to spend more time serving and focusing on foster youth?
Thank you for the question. Funding streams are the reason that caseworkers are required to spend so much time on administrative and compliance work. They need to document the work that's being done so that they remain in compliance with the regulations tied to those funding streams. So agencies worried about losing their funding overburden caseworkers with tasks, making them responsible for doing the work in alignment with this compliance. What our AI does is this compliance work in the background. I'll give a specific example. In Illinois, there are requirements around visiting children in a specific amount of time. The data that was in their outdated system could not show the entire scope of this work. There are what are called good faith efforts that are made that are considered visits. So what the AI did was look in the background for all of the examples of visits and good faith efforts, and Illinois went from not exceeding the requirements in an audit to far exceeding the requirements in an audit without requiring caseworkers to do any more compliance work. There are so many different audits that they're required to work on or complete documents for that it overburdens them. So what we're doing is giving them back time away from the compliance work. But more importantly, because we're giving them back time and because we're giving them back the data about families, we help them to establish trust with the children and families they're caring for. They don't have to ask that family to repeat their story over and over again every time there's a new caseworker on the case. That information is delivered to the caseworker, and what we've heard is that children are now finally feeling heard by the system because the caseworker is coming prepared to that visit with them or that phone call with them. It establishes this trust, and it establishes helping them get set on the right path.
Thank you for that. Dr. Jacobs, in your testimony, you discussed the importance of identifying a supportive network for foster youth. The use of your technology has helped find a remarkable average of 30 connections per youth. How do you believe the Shafee program can be improved to help youth make permanent connections with family or other stable adults?
Thank you for the question. The Shafee program can be improved by making it clear that these funds can be used to help states build these family connecting tools, training, and education. As we've heard here several times, technology is not a solution, it's a force multiplier. So those who are going to use the tools need the training and education to understand why relationships matter so much for human beings. When they have that understanding, they dive into this work with a passion, and that's where technology allows their efforts to be multiplied.
Excellent. Thank you for that. Ms. Carr, I'm going to turn to you next. Access to stable housing is something you talked about in your opening statement and is one of the top concerns when it comes to foster youth. According to federal data, 34% of foster youth experience some type of homelessness. Based on your experience as a caseworker, what do you believe makes the biggest difference in reducing homelessness?
Thank you for that question. Based on my experience, I think that early on support and prevention methods helps with supporting and reducing homeless and youth that's in the age population that I support. Utilizing Guide Tree, it helps us to recognize drivers that will help support the youth with their transition. For example, the case that I used, Dion. When I got that youth, I basically went through this portal guide tree, found some interventions and some things that I can work on that would benefit him. One of those resources was pooling family supports. Through pooling family supports and working with that young man, I was able to get information for his father and able to bridge that gap and get them back together and stabilize his placement in the community.
Thank you for that. Mr. Lewis, I'll turn to you next. In my home state of Illinois, Care Portal has served more than 2,000 foster youth and families involved with the child welfare system over the past 3 years. Is Care Portal able to track outcomes for youth, and how do you assess performance to ensure resources are getting where they're needed?
I appreciate the question. Two parts there. On the first part, where we've seen the most evidence of success is through the lived experience of caseworkers and responders and people engaging with the families. Remember, what we're after here is meaningful connection. We're after establishing relationships where love and stability and support of a family can make a difference. And so the one example I gave you of the 70,000, caseworkers who were surveyed, we have tons of that kind of data. Where we are building our credibility and our opportunity here is through outcomes like evidence-based research. We have the beginnings of one in Florida, but we have lots of opportunity to go deeper in that. So there's room with resources to be made available for us to do more research to just prove how relationships make a difference in people's lives. As far as resources are concerned, this is the beauty of it. The caseworkers are the ones who close the requests. So when a caseworker submits a request on behalf of a mom who's trying to keep her kids out of care or a youth who's aging out, the caseworker has a relationship there already, and the caseworker is the one who says, yes, so-and-so from the community met this need, and now I can close it. And so the reliability of the need actually being met comes because the caseworker says it happened, and if the caseworker says it didn't happen, then it didn't.
Thank you for that.